It is important for medical personnel to have a sound knowledge and understanding of the basic anatomical terms. With the aid of a medical dictionary, you will find out that understanding anatomical terminology greatly assists you in the learning process. The accurate use of anatomical terms by medical personnel enables them to communicate with their colleagues both nationally and internationally. All description of the human body are based on the assumption that the person is standing erect, with upper limbs by the sides and the face and palms of the hands directed forward. This is the so-called anatomical position. The various parts of the body are then described in relation to certain imaginary planes. Mid-sagittal plane is a vertical plane passing through the center of the body, dividing the body into equal right and left halves. Planes situated to one or the other side of the median plane and parallel to it are termed paramedian. A structure situated closer to the median plane of the body than another is said to be medial to the other. Example, your eyes are medial to your ears. It shows that your eyes are closer to the midline. Similarly, a structure that lies farther away from the median plane than another is said to be lateral. Example, the ears are lateral to the eyes. Coronal or frontal plane is a vertical slice that divides the body or an organ into front anterior and back posterior. Horizontal, also called transverse plane or axial plane. It divides the body into top superior and bottom inferior halves. The terms anterior and posterior are used to indicate the front and back of the body, respectively. Example, the sternum is anterior to the heart. In describing the hand, the terms palmar and dorsal surfaces are used in place of anterior and posterior. In describing the foot, the term plantar and dorsal surfaces are used instead of lower and upper surfaces.
The term proximal and distal describe the relative distance from the roots of the limbs. For example, the arm is proximal to the forearm and the hand is distal to the forearm. The terms superficial and deep denote the relative distances of structures from the surface of the body. Example, the skin is superficial to the bone. The terms superior and inferior denote levels relatively high or low with reference to the upper and lower ends of the body. Example, the heart lies superior to the diaphragm, while the diaphragm lies inferior to the heart. The spine position of the body is lying on the back. The prone position is lying face down. Flexion is a movement that takes place in a sagittal plane. For example, flexion of the elbow joint approximates the anterior surface of the forearm to the anterior surface of the arm. Extension means straightening the joint and usually takes place in a posterior direction. Lateral flexion is a movement of the trunk in the coronal plane. Abduction is the movement of the limb away from the midline of the body in the coronal plane. Adduction is the movement of the limb towards the body in coronal plane. Pronation of the forearm is the medial rotation of the forearm in such a manner that the palm of the hand faces posteriorly. Supination of the forearm is the lateral rotation of the forearm from the pronated position so that the palm of the hand come to face anteriorly. Is the combination in sequence of the movement of flexion, extension, abduction, and adduction. Inversion is the movement of the foot so that the sole faces in the medial direction. Eversion is the opposite movement of the foot so that the sole faces in a lateral direction.
In conclusion, anatomical terms provide a clear and standardized language for describing the human body. Understanding these terms is essential for accurate communication, learning, and clinical practice in the health science. If you enjoyed this video, like, share, and subscribe to the channel. Turn on your notification button for more anatomy lessons.